Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 30 new cases of COVID-19 in Windsor and Essex County. Of the 30 cases, 10 are close contacts of confirmed cases, 7 are related to an outbreak, 7 are community acquired, and 6 are still being investigated. We have had 13,505 cases since the beginning of the pandemic. 12,825 cases are now resolved, and 279 people are active at this time. 39 preliminary or confirmed variants of concern cases have been identified in Windsor-Essex, and 2 cases have the UK variant. 23 confirmed cases of COVID-19 are currently in the hospital, and 4 people are in ICU. We have lost 401 people to COVID. There are currently 11 active outbreaks in Windsor and Essex County. 5 are in workplaces, 4 community outbreaks, and 2 long-term care and retirement homes. To provide a vaccine update, we are part of the pilot site for the pharmacy rollout. There are currently 57 local pharmacies across Windsor and Essex County that are providing AstraZeneca to adults aged 60 to 64. We have added these sites on our website and links to the participating pharmacies. Alternatively, you can book an appointment at ontario.ca/pharmacy COVID vaccine. At this time, the pilot study in our community remains targeted to the 60 to 64 age group. Pending further direction from the ministry, we encourage this age group to contact a participating pharmacy for their shot. Regarding the immunization clinics for those over 80 years, please continue to book for this clinic if you're over 80 and pre-register or call 519-251-4072. You will then receive a return phone call and you will be booked by either our health unit or Windsor Regional Hospital. We are booking over 700 people a day for this 80-plus clinic, and anticipate that we will be completing everyone who has pre-registered by mid to late next week. To date, we have administered a total of 54,460 doses of vaccine in Windsor and Essex County. Please check in with your family and friends who are in these age groups and help them pre-register if they have not already done so. And also, for more information about our COVID vaccines, visit our website at wechu.org. I know we received a question yesterday about reactions from the vaccination, and a common reaction or a common side effect would be just pain, local pain at the injection site, or redness or swelling, being tired, possibly a headache. So just those are a couple common reactions when you receive a vaccine. Also yesterday, or on the day before, you asked about questions about the OHL. So we did our follow-up, and the health unit is working directly with the Windsor Spitfires operations and are currently reviewing their safety plan with their designated task force. So the WFCU Center, Windsor Spitfires, and the City of Windsor are all involved with the planning. We have our public health inspectors on site to conduct walkthroughs and provide additional information regarding infection prevention and control measures. They will have enhanced cleaning and during events when they're permitted to hold them. So right now, I was told they have very thorough plans and that everyone is working together to review them. So at this time, as you know, we're not sure how long these targeted vaccination mass vaccine clinics will last and if that will hinder any of the traffic at the WFCU. So more to follow on that. Also yesterday and the day before, there was a question about the third wave, and I deferred to our epidemiologist at that time, and I've actually invited our epidemiologist to attend today and provide an overview of our situation, specifically about the third wave question in Windsor and Essex. So before I turn it over to him, I want to take this time just to acknowledge the great work of our Epi department. Ramsey D'Souza, who you'll hear from in a minute, is the manager and has been working with his team this past year to provide all the data, reports, EPI summaries, projections, everything you read about and hear for Windsor-Essex County. His work and the work of his team have been invaluable during this pandemic. So I will now turn it over to Ramsey, who will provide some more insights into the third wave question.
Thank you, Teresa. Hi, everyone. My name is Ramsey D'Souza, the manager of the Epidemiology and Environment Department here at the Health Unit. So today, as Teresa was mentioning, we did receive a question about where does Windsor-Essex stand with regards to the third wave locally. And hopefully this presentation will provide that overall summary. So first I wanted to reach out and talk about what's happening in Ontario as a whole. As you can see with this epi-curve here, especially highlighted in the red box, we do see that the overall trend in Ontario is now increasing once again. The end of the second wave happened in the first week of February, but now as we've entered March, those rates are now increasing. Relative to Windsor-Essex, our numbers have actually stalled. We do, however, though, it is high and has been high in terms of what we've seen in the first wave. For example, at the peak of the first wave, as highlighted in the red box, in about June and July, our numbers are the same in terms of what we're seeing right now, which is about 30 cases a day, give or take, plus minus 5. So even though we've leveled off, our numbers are still relatively high to where we should be. In comparing both the trends in Windsor-Essex and Ontario, as you can see in the red box, which represents the previous numbers, which I showed in the last slide, our numbers are consistent in the sense that while we are out of our second wave, it has stalled, but has plateaued to the point where it's still pretty high. In comparison, in the black box that's highlighted, you can see that Ontario's numbers, while they did decrease after the second wave, we are now seeing that trend increase, and didn't really decrease to the point where we would have liked to be as a province. So did have raised concerns overall for Ontario. Comparing our week-over-week rates once again, this graph shows that our weekly rates are still relatively high to what we've experienced overall. While we are out of the second wave, our week-over-week rates are high, which is keeping us in the red at the moment. And these are the same rates in terms of what we saw as a peak in the first wave. Looking at our numbers in comparison to Ontario and overall for the southwest region of Ontario, in Ontario, as we mentioned before, it is increasing. And in the southwest region as well, it is slightly increasing as well. However, the blue line, which indicates our rates in Ontario, has once again, as mentioned earlier, has remained fairly consistently high, but stable. With regards to hospitalization, where are we at? So the blue line has indicated that since the end of the second wave, our numbers have actually gone down, whereas the green line for Ontario has shown that it has increased in the past couple of weeks. Similarly, for the ICU, the same trend follows. The ICU numbers for the province, while it has decreased after the first wave, hasn't decreased to the level that we've seen in Windsor-Essex. And we also get the question regarding the variants of concern. So what we're seeing here is from February onwards, we are seeing more and more of the variants, and it has increased, especially so in the last week of February, and we are seeing more and more of these variants in our community. We won't know, for example, how many more we need due to the processing of these tests in our lab. So, an overall summary of what was talked about earlier. The Windsor-Essex currently at the moment has not entered a third wave, but remains on the precipice. Our case rates and 70 averages remain high for the region, which is keeping us in the red. We are seeing an increase of variants of concern since late February. In comparison to Ontario, however, they are at the beginning of their third wave. They have an increase in weekly case rates. Their 70 moving average has also increased alongside the hospitalization. a region to ensure that we are following all the measures, so that way we can continue to have a downward trend from a second wave and drop our numbers even lower. Thank you.
We'll now take media. Today we'll start with CBC.
Hi, good morning, and thanks so much for your presentation. You said that we're not in the third wave, but we're on the precipice. Do you think that we can turn it around, or do you think it's sort of an inevitability at this point?
I think as a region, we do have the ability to. Our numbers, as we mentioned in the presentation, it's been fairly consistent. So one new case is typically generating it's coming from one old case. So in terms of what we're seeing, we do have the ability. It is the onus always falls on us as a community to follow the measures as it's intended to physically distance, wear a mask, stay home if you're sick, and so on. So it's possible, but once again, we're not also in an isolated situation. We are a pretty mobile community alongside with alongside the other residents in Windsor-Essex and Ontario.
Thanks very much. So, Teresa, based on what we're hearing right now, it sounds like that you haven't had any of those conversations with the province about us moving forward or backward in the COVID-19 framework. Is that accurate?
That's accurate. So right now we continue to be in the red control zone.
Thank you.
Any questions from Blackburn?
Yes, Teresa, you mentioned a little bit of an earlier deadline for that 80 plus. You're thinking mid to late next week. Earlier you said the end of the month, which I guess would be middle of the next week. Anyways, do you anticipate registering the next age group shortly, this 75 plus?
So that is our intention, to move through the ages that are prioritized. So right now it is in 5-year increments. So we will, it's not a last call, but we want to urge all of the people that are over 80 to continue to pre-register. They will always be eligible, but we know that we have 16,000 people over the age of 80 that have pre-registered, and it is likely we'll be moving into the 75 plus. And we're just working internally and with our partners on that booking of that, but that's the logical, next progression. Yeah, we'll move along and use the vaccine that we have to get people vaccinated.
And I know the hospital was working on the frontline healthcare workers kind of in the community. I'm seeing here, we just got an email from the teachers associations in the city who are requesting that they have an opportunity to get vaccinated sooner rather than later. Well, they're wording now. Where are they on the timeline, and have you considered moving them depending on where we're at with our own vaccine rollout?
So based on the provincial plan, the teachers would fall under phase 2 in the overall plan, and so right now they're not prioritized under phase 1. So we'll continue to complete the 80 plus and people with chronic medical conditions, but the teachers would be in the next phase, and we haven't had any other discussions. If there's a change in prioritization, it would be through the medical officer of health and the prioritization committee. But at this time, we're just following the provincial guidelines that have been rolled out.
Yeah, I guess the reason I asked, according to them anyways, the Niagara and the Guelph region, they were moved ahead based on their own protocols, I guess, opposed to the provincial timeline.
And other areas, like there is the ability to move people concurrently based on local situations. So without being able to, be aware of the circumstances, right now, the teachers aren't, being immunized unless they're in one of the age groups, like, the 60 to 64 that have access to AstraZeneca through the pharmacies right now.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Teresa, and good morning, Ramsey. Thank you for your presentation. Teresa, you mentioned that the 75 plus age group would be the next logical group to register for vaccines. Can we anticipate an announcement about that starting next week, or do you have a time frame in mind?
So we are working internally about the booking system. As you know, we're not using the provincial booking system. We're investigating, not investigating, we're finalizing a booking system right now that would allow people to register themselves and receive an appointment. So pending confirmation of the details of that, we'll give, and you're right, we'll give more information, a media release, and announce it. But we still are concentrating on those that are 80 plus, but things are moving quickly, as you know, and based on our projections, we do anticipate being a little ahead of schedule. I think I previously said we were thinking maybe the end of the month we'll have the everyone who was pre-registered completed, but now with other sites being available, with Windsor Regional Hospital, the Sportsplex, the downtown Windsor Hall, WFCU, the Nature Farm Fresh in Leamington, and also on March 29th we'll be working with Amherstburg Libro Center. So there will be a lot of access to vaccination sites, and we're using whatever we can based on the vaccine allotment that we're receiving. So it's not a great supply, like it's not an endless supply, but we have a lot of avenues to get it out, and we're moving really quickly. So that's good news.
And can you reiterate the health unit's involvement, if any, in the pharmacy vaccine rollout? I am seeing on social media people calling for the health unit to expand vaccination beyond the 60 to 64 age group, but that's not your call. So can you talk a bit about that?
So it's not our call, but we are working with the ministry. Well, not, the ministry's directing this. And based on any further information we receive from the ministry, we will apply it if we can to our existing pharmacy rollout. So if there is a change in the age category direction, we will make sure we communicate that to the pharmacies that are participating, and they will move with the direction. So right now, anyone that's 60 to 64 should be getting that vaccine, because with the with the expansion of the AstraZeneca, it is likely that other age groups will be able to access this vaccine from the pharmacies.
And are you having any preliminary conversations about that age group being expanded for the pharmacy rollout?
I would say that I've participated in meetings where that is exactly what's being discussed.
So in terms of the health unit's relationship with the pharmacy rollout, are you sort of relaying messages that you're receiving from the ministry down to the pharmacies? How's it working?
Well, there's not a lot to relay. Initially, the ministry worked directly with the pharmacies. We participated. We have connections locally as well, and are communicating, supporting them in any way we can. You'll see that our website, we've really we've now listed every pharmacy. We have a map. We have more information there, so people can feel confident that this is a good route to go if you're 60 to 64 at this time, and to get your AstraZeneca. And then if there's further information, the ministry is likely working with the Pharmacy Association as well through all of this. But as soon as we hear anything, we will communicate that to our local group. So, we're doing what we can to support the rollout, and I think what is, based on what we see and the amount of vaccine that remains in some of the pharmacies, is that some pharmacies have quite a bit of the vaccine left, others do not. And so we do want to encourage everyone, if you're in that age group, get vaccinated. It's a good system. It's it's available, and it could change the age group. I am anticipating it will, but right now, today, and anyone who's booked for 60 to 64 still have access to it. So I would recommend that they use that avenue as soon as they can.
Thank you.
Any questions from AM 800?
Teresa, just to clarify, the Amherstburg location will be opening on March 29th?
Yes, we have plans. Well, we're working with the Libro Center, and maybe I announced that a little bit too soon. But yes, we are. I'm sorry. We are working with the county to get that up and running as well. So I don't think it was any secret that Amherstburg was the another site we were working on. But we are anticipating at the end of the month, and more to follow. So. Sorry if I jumped the gun on that one.
And then you mentioned the OHL and how the health unit is working with the Spitfires in the city on the plan. If the plan is not up to par to the health unit, could the health unit turn down this plan and tell them to work on something different?
I think, and I'll only speak for our approach in the past, it's very collaborative. It's not with the intent to shut anyone down, or it's just to say, oh, what about this? And I know I mentioned the infection prevention and control measures, and throughout the pandemic, there are clear, expectations, a safety plan, and the safety plan includes all of that. What does the active screening look like? What are your, the signage, the prevention control measure, infection prevention control measures, all of those pieces. So that has to be in place, that has to be posted, accessible for anyone who requests it. So I think it's a collaborative approach. There would be no reason to think people are gonna, not be approved based on some unknown expectation that is outside of what we know is needed during a pandemic and to prevent the spread of COVID.
Switching gears to the 75 to 80 age group, any idea how many individuals in that age group live in Windsor-Essex?
I believe we checked that out, and I have so many numbers in my head, but I thought it was 15,000. So if I'm accurate with my recollection, we would, if that is the case, we would be moving through that group quickly too, just based on the amount of access we have to vaccines. So it really will be a case of how much vaccine are we getting to roll this out.
And then a question to Ramsey, if he's still on the call. Ramsey, I know it was asked about the red zone and switching to the orange zone, and I know the public is obviously listening and they want to know. So as it stands right now, is it safe to say Windsor-Essex, unless something changes, will be in the red zone next week?
As of right now, based on the numbers, some indicators do fall into the orange and some do fall into the red. So I think just looking at numbers, it is still high, and I can see it still staying in the red.
Thank you.
Any questions from CTV?
Hi, yes, good morning. What are your thoughts on the Ontario Science Table saying that we need a 3-week strict lockdown in order to prevent a third wave? Do you think that that would be effective, or?
I would leave it to the science table. I'm not really sure. I think all along we know what's been effective in preventing the spread, and it's the same messaging, staying home if you're sick and minimizing your contacts, maintaining distance, wearing a mask, all of those pieces. Download the COVID exposure alert app. So I don't know about a lockdown. I'm not really sure when we'll be able to defer that to the medical officers of health and their expert opinion. But I am pretty confident in all of the existing public health measures that exist. That's what we need to do to continue to do to prevent the spread and keep us all safe.
And in a previous story we heard from hospital officials that they believe Windsor tends to have a pattern of lagging behind other locations by about 3 weeks. Have you noticed the same pattern, or any way to kind of break that?
I think I'll defer to Ramsey if he's able to comment, but I'm not sure if that's true or not.
I think it depends on the scenario. I know, for example, if you're looking at when the second wave began, we were seeing a number of school-related outbreaks and dismissals happening that was higher than some areas in the province as well. So it depends on what we're looking at. For example, hospitalizations are higher right now in other areas of the province compared to us. So whereas some areas have had lower case rates, but ours has remained fairly high but stable. So it does vary. I think the lag depends on the indicator that we are looking at.
Thank you. And for Teresa, I was just hoping to get an update on contact tracing. I know that for a while we were using remote workers, so is that still happening? Is there still a backlog? And is there more urgency or priority on variant cases?
So the case and contact management is going well. We still use the ministry external contact tracers as well as our own staff, and we also have an external group that we had hired out through our board approved budget. And so we're using all of those avenues. I think I've talked about the fact that as we do roll out the vaccine, nurses are supporting the vaccine clinics as well, and will be, if they are doing case and contact management, they will likely rotate into a schedule into one of the mass sites. Everything, I would say that they continue to, do their work and have been able to manage everything in a timely manner. We are seeing a lot of with the schools returning, we do see that there are dismissals of cohorts. We have a process in place that is very timely, and we get people isolated and home as soon as possible. So I would say everything's going well. I don't see any issues at this time. We do know that the province has informed us that they will allow us to maintain the contact investigators that they've provided to us till through to June. So that's perfect timing. We appreciate that a lot. But yeah, things are going well.
Great, thank you so much.
Any additional questions from CBC?
Yes, Teresa, with regards to vaccine shipments, earlier this month, Dr. Ahmed said that by the end of the month, we could be receiving as many as 13,000 doses per week. Are we still on track for that?
So we typically are getting Pfizer and Moderna. So with the Pfizer, we do know that they are basically shipping every week, and through the end of the month. So this is toward the end of March and then into April, we do know that we are getting approximately 14,000 doses a week, but it does drop off a little bit into April to about 10,000 doses. And for Moderna, we're getting much less. And as you know, we've been using Moderna for more of the long-term care and retirement home immunizations as we continue to follow up with people, and also in some of our mobile clinics. But we have a lot less of the Moderna. I think our shipment was only like 2,500 doses this last time. And, so we're monitoring all of that. So if we receive more information about our allotment, it will likely be the Pfizer, and that's what we're using in the mass clinics. But right now, we're using everything we're receiving, but I wouldn't say, it's a steady of 14 every week because, as I indicated, there are a couple of weeks in April where it drops down a bit.
Okay, thank you. In Chatham-Kent, the medical officer of health yesterday, he was sort of expressing frustration with other levels of government. He said he was aghast that there was no plan to vaccinate temporary foreign workers on arrival. Given all of the outbreaks last year, I'm wondering what's your reaction to that and whether you share those kinds of concerns about a plan from other levels of government.
I can speak about the agri-farm workers. They're definitely on our radar. We would like to immunize them when we're able to. We see that in phase 2, that they are clearly outlined in the provincial document, and we will move forward with immunizing the group. I do think it's very important that we immunize people that are in congregate settings and have the ability to transmit COVID very readily, and that's in this group. And we saw this last year. We saw the impacts in Windsor and Essex County. So our health unit will be advocating to vaccinate agri-farm workers as soon as we can.
Thank you very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, Teresa, you mentioned that some pharmacies are out of the vaccine and some still have quite a number of doses available. Is there any system in place to let the public know which pharmacies still have the vaccine available?
I believe 56 out of 57 have vaccine available. So if you go to our website, they'll be able to click on and try to, get an appointment. I don't know if you can get an appointment through that, but you can click on and then follow up with however they're booking their appointments. But there are, I did hear of one shoppers that had used their vaccine. It was in Tecumseh that they had finished using their allotment of vaccine. But other than that, I know that we have looked at the numbers and everyone else has vaccine left. And some have quite a bit. But the participating pharmacies, if you go on our website and look at the mapping, they're in Windsor and Essex County. So there's availability throughout not only the city, but in municipalities outside of the city. So that's really good.
Did you have a sense, did you expect that more people aged 60 to 64 would be signing up for the vaccine than have already? Or what's your reaction to how it's been going so far?
Well, and you as journalists, that with the release of the vaccine also came a report about the vaccine, the pharmacy pilot, and then the report of the vaccine. Everything has been, NACI, Health Canada, have moved forward with the safety and efficacy of AstraZeneca. So I just want to make sure people know that the vaccine is safe, effective, and it's here in Windsor, so let's use it. And I think maybe the timing of it, people waited to see, but I would not hesitate to get a vaccine that's available to you at this time.
Are you seeing some vaccine hesitancy because of the report and the vaccine coming out at the same time?
I can only, I'm assuming there would be, but I know that I've received calls, about, what do you think? And it's like, get it, there's no thinking. And but you're also talking to someone who has no vaccine hesitancy. I just want to protect everyone that needs to be protected, which is every one of us. And,
And finally, Ramsey, this is a more general question, but since you're usually behind the scenes, how are you managing 1 year into the pandemic?
It's been hectic, but the work that goes on is really there to inform our leaders and our partners in the community about COVID, what's happening in the community, and how we're faring. I think the work never stops, but it goes
Thank you.
Any questions from, or additional questions from AM 800?
Sorry, Teresa, a couple more if you don't mind. I know the board meets tonight, and on the agenda it says about the special board meeting that was held on March 4th about the budget. I know my colleagues at CBC asked this question, I believe it was last month, but has a number been determined on overtime yet during the pandemic? I was just seeing other health units, for example, in London, their overtime was about 700,000 and their medical officer of health was 14% of that. Do we have a number here locally yet?
Of our staff overtime, I would have to, yeah, I don't even know if that was, yeah, I'm thinking about the budget. I know that we have, you know, the last year, like, you know, the end of the year would have been all calculated for the overtime, and there was definitely overtime. Our nurses were working, you know, overtime and every day of the week. As you know, we went from a 5-day operation to a 7-day operation. So I'm not sure. It was extensive. There was a, you know, we put extraordinary costs into the ministry regarding our staff, our public health inspectors, our managers received some compensation as well, as did every level of our organization. So I don't have that number, but I don't know. I'm sorry. I think I'm trying to figure out what it could be, but it is significant. I'm sure you're aware that people were working outside of regular hours every day, and I know Ramsey's really minimized this past year, but this is someone that has, you know, I could call him any day, anytime, and he's available. This has been a big part of all of our lives for the past year. So regarding the overtime, all I can say is it's significant, but it was necessary, and everything that we have tracked was for, to protect our community and get the resources and the staffing levels we needed to address the pandemic.
Thank you.
Any additional questions from CTV?
No, thank you.
Thank you, everyone.